Okay, so I would first start off by introducing myself. So hi, my name is Hillary Jordan. I am a student nurse at the University of South Alabama, and I'm here today to do your IV insertion. The first thing I wanted to do is verify my orders. So it does say Rocephin 1 GM IV every 8 hours. I'm also going to check hospital policies, which I'm going to state that I did. And after I have done that, I'm going to make sure that I have all my equipment, which I do, and then perform hand hygiene. Once I perform hand hygiene, I'm going to check my 2 patient identifiers. So we're going to start with the name. I'm going to compare it from the order form to her armband. So it does say that Jones Jaguar, and her medical record number is 417 63 63 52. So this matches on both the order form and her wristband. We're also going to check for allergies while we're here. And the order form and her wristband does say that she's allergic to penicillin. So that's good that they match. So the next thing I'm going to do is grab my trash can. After I'm done moving my trash can, I'm going to perform hand hygiene again. I'm going to make sure I put my goggles on. Okay, normally the patient would be supine in bed, or they can be sitting, it doesn't matter. But if the patient is supine in bed, you're going to want to raise the bed height to working levels, which is to your waist, and make sure that the side rails are down. And you want to make sure that you're providing privacy. So after that's done, I'm going to set up my equipment using sterile technique. I'm going to organize it while I'm setting it up as well. I'm going to take this out, making sure not to touch the ends. Do the same with my solution, and then I'm going to get my tape ready. Okay. Once this is done, okay, I'm going to take my alcohol wipe and clean my extension, making sure to maintain sterility. Okay, with this done, go ahead and put it in the trash can. I'm going to uncap my solution. Make sure that the air is out, which it is. Insert it into the end, and then prime the line. I'm going to loosen the end of it, so it'll be easier to do. Like I said, once again, we're maintaining sterility through all of this. Place it back down on the paper, and now that that's done, I am going to put on the tourniquet. So you put the tourniquet on 4 to 6 inches above the side. So the way you do it is making sure that you're available for quick release. Once that's done, you're going to check the appropriateness of the vein. Also check peripheral pulses. Okay, and if you need extra prep time, you're going to release the tourniquet. Now we're going to apply gloves. Make sure that we're applying clean gloves, that's important. Okay, I'm going to move my saline lock nearby, maintaining sterility, putting it on the paper. And then once that's done, I'm going to use the chlorhexidine to clean the area. So you're going to start by going horizontal, vertical, and then circular for 3 seconds. That's done, you're going to dispose of it. You're using friction in order to clean it, and once that's done, you're going to allow it to dry. Now that this part of the video is done, I'm going to pause and move the camera for a better angle for the next portion of the video. Okay, so for this video, I'm going to be demonstrating how to do a V9 puncture. So you're going to start by anchoring the skin 1.5 to 2 inches below the insertion site by gently pulling away from it. You're going to make sure that you're not touching the cleansed site, and that when you do get your ONC, which you're going to go ahead and get, that it doesn't touch the anchoring dome. So you're going to want to insert it bevel up, which is that way. You're going to want to insert it at a 10 to 30 degree angle. You're going to also want to tell your patient that it's going to be a quick stick and to make sure they remain still. So I'm going to insert it, bevel up until I get venous return. Once you get venous return, you're going to drop it down and then insert it another 1/4 of an inch. Once that's done, you're going to advance the catheter to the hub without advancing the stylet. You're going to put pressure, or actually you're going to, after you do so, you're going to pop off the tourniquet, which is the push and pop method, while stabilizing the catheter with your other hand. Once that's done, you're going to put pressure about 1 1/4 inch above it, and then remove the stylet. And then remove the stylet from the catheter and put it into the sharps container. You're going to want to quickly uncap this using sterile techniques and then attach it to the end, making sure sterility is kept at all times. Then you're going to want to anchor it down to make sure that it stays, and secure it with tape. Once that's done, you're going to want to aspirate gently for blood return, and then you're going to flush the vein with the remaining saline. You're going to want to make sure that there's no swelling on the site. Once that's good, you're going to disconnect and throw that in the sharps container as well. So after you've done that, you're going to want to apply the sterile transparent patch. When doing so, you're going to want to make sure that you are not touching the bottom of it, just touching the sides, and then you're going to place it over the hub. Okay, and then once that's done, you're going to want to reposition it in a more natural position. Normally you would use 2 pieces of tape, but because the banana is so small, we're just going to use 1, just so it's not completely on top of each other. And after I have done that, I'm going to dispose of my equipment. I'm going to take off my clean gloves. And then I'm going to create a label. We're just going to use the tape as a label. So for the label, you're going to put the date, the gauge of the needle, gauge of needle, gauge of needle, the time, and then your initials. And then you're going to place that at the end of the dressing. Once that's done, you're going to want to reposition your patient comfortably. Make sure that you lower the bed back down and raise the side rails. You're going to also want to tell them how to prevent dislodging, which is just to be careful of the IV when you're moving, and tell them that if they are taking a shower, to let you know so that you can wrap it. Also, ask them to let you know if there are any signs of blood in the tubing or around the dressing, and if the rate is slowed or stopped, the flow of it. You also want to ask them to let you know if there's any complications, the sizes of those complications, which is infiltration, phlebitis, and inflammation. Once you've done that, you're going to perform your hand hygiene, and then you're going to leave the room and document at the nursing station the date, the time, the location, the number of attempts on the patient's tolerance, presence of the saline lock or the flow rate, and the method of infusion if a fluid was prescribed. And so then after that's done, you're going to, we're going to show you how to do it if you are discontinuing the IV. So you're going to once again want to make sure your goggles are on and apply a clean pair of gloves. You're going to want to make sure that any fluids that are attached to the IV are turned off. Okay, and then you're going to want to start by removing the tegaderm. So when you're removing it, you're going to want to remove it coming in towards the insertion site. Okay, and then once that's been removed, you're going to want to take your 2x2 gauze and place it just above the insertion site and apply pressure. Okay, and then you're going to want to remove it by gently pulling it out the IV parallel to the vein. Once that's done, you're going to want to check and make sure that the tip is still intact, and then once you check that, you can dispose of it into the sharps container. And as you're doing that, you're going to want to gently apply pressure for 30 seconds. And if they're taking anticoagulants, you want to do that for around about 5 minutes to make sure that they're not bleeding. Then you're going to take a piece of tape and put it over the gauze, and that is it for discontinuing the IV catheter using asepsis and hemostasis techniques. You're also going to want to dispose of whatever equipment you use along with your gloves, and then document it at the nurse's station.